Do raw disease stages change depending on where you live? Imagine a world where the stages of rheumatoid arthritis stay the same no matter where you are. That's because the way the disease progresses is based on biological changes in your joints and body. The stages, early, moderate, severe, and end stage, are universal descriptions of how the disease affects joint damage and function. These stages are consistent across the globe because they reflected the biological process of inflammation and joint destruction that happens in rheumatoid arthritis. However, where you live can influence how quickly you move through these stages and how the disease is managed. For example, in countries with advanced healthcare systems, people are more likely to get diagnosed early. Early diagnosis means treatment can start sooner, often at the early or moderate stage, which can slow or even prevent severe joint damage. On the other hand, in areas with limited healthcare access, diagnosis might be delayed. This can allow the disease to progress unnoticed into more severe stages before treatment begins, leading to more joint damage and disability. Treatment options also vary by location. Modern medications called disease-modifying antirheumatic drugs or DMARDs, including biologic therapies, are highly effective at slowing disease progression. These are more available in developed countries and urban centers. When these treatments are accessible and affordable, they can help keep the disease in earlier stages longer. But in regions where such treatments are scarce or expensive, the disease may advance more rapidly to severe or end stage, causing more joint destruction. Environmental and lifestyle factors play a role too. Smoking, for example, is a known risk factor that can worsen rheumatoid arthritis and speed up its progression. Different regions have varying smoking rates, diets, and exposure to environmental toxins, which can influence how aggressively the disease develops. Genetics also matter, as certain populations have genetic predispositions that can affect disease severity, but these do not change the fundamental stages of RA. In essence, the stages of rheumatoid arthritis are the same worldwide because they describe the biological progression of the disease. But the speed at which someone moves through these stages can be affected by healthcare access, treatment availability, environmental factors, and genetics, all of which are influenced by where a person lives. Recognizing these differences highlights the importance of early diagnosis and access to appropriate treatment to help manage RA effectively, regardless of location. Always consult with healthcare professionals for personalized advice and care tailored to your specific situation.